Cool, you ready? Hey bud.
You right?
How are you?
Good, how are you?
Good, good. Gonna clip this onto you. Are you gonna take this jumper off?
Not for the treatment, probably.
No.
Actually. Yeah.
Have you been? Let's see the... Oh, it's still swollen. Has it swollen up again after it's been... No.
I don't think it has.
Okay, right.
It's the same.
Come on in.
Oh yeah, I showed you the picture on Monday.
Yeah.
And it was massive.
Yeah. So when they, when you saw that dermo clinic, this is by the way, my nurse.
I am wrong.
Cool. Hang your jacket up, bag up. Cool. Take a seat. Yeah. When you saw that dermo clinic, did they look at your teeth and gums?
Yeah.
But
I mean,
they won't really know.
visually,
Yeah.
But he said, same as the doctor. Actually, yeah, I'm gonna take this up.
Right.
He says to the doctor, as the same as the doctor, it's like it's a really strange place to get it, and it could be tooth abscess, but there's nothing looks wrong with them. But then he was like, well, I've not had a dental check for like a year, so you couldn't get one.
Yeah. What I'll do like a full checkup, and I'll take a look at that area as well.
Yeah.
That was an ultrasound that you showed me, wasn't it, of the area?
Imagine that was on Thursday though.
Yeah.
It was still quite small.
Yeah. Fine. Cool. And they gave you clarithromycin.
Yeah.
Yeah. Taking that. You're on your
Friday.
third day.
No, I started that on Friday.
Okay, fine.
So
Who gave you the clarithromycin?
doctor.
Oh, was it Friday you went there? You went to the GP on Friday.
Yes.
Right. Who gave you the
GP on Friday.
Right.
Oh fuck, was it Friday actually? Yeah, I think it was Friday. After work on Friday, and then Monday was the dermatology. So
Fine. To get it. Okay. Cool. Fine. Apart from that, is there any other issues that you want me to look at?
teeth wise.
Yeah.
No, maybe take a look at the old.
That tooth on the top right.
Where I had the
Yeah.
root canal.
Yep.
Just,
No
There's
issues. Just
nothing
make
wrong
sure
with
it's
it.
fine. Yep. Did you get a crown on? Did you get a crown on it in the end?
Mm-hmm.
Yeah. Fine.
This tooth here maybe.
Right.
I think it's the first molar.
Yeah. Yeah.
Just because I've actually stopped using my retainers.
Okay.
Well, but I slowly stopped using them just
Yeah.
since I wore them like once a week. And eventually found whenever I wore them, that tooth was sensitive the morning after.
Fine. Right.
So I've just stopped using them.
Fine.
I've not used them for like a year now.
Right. Okay.
I don't think anything's actually moved at
Fine.
all, but just to like, it would be nice to know why that's sensitive. It was
Fine.
just, but
Cool.
otherwise, no, it's fine. Like, I don't have
Okay.
any sensitivity.
Cool. Right. So, recap. You had a big swelling on that lower left, which is still there. Saw the doctor on Friday. Got antibiotics. Saw the dermatology clinic on Monday. Got it drained. It's still a bit swollen there. Any pain from it?
If I touch it,
Yeah.
and if right now it's fine.
Okay.
Can't tell. Say when the skin starts to pull on it, that's just a sort of
Just putting pressure on it. Yeah. But no sort of like dental pain or ear pain or anything that you think of.
No,
Cool.
there never was
Fine.
dental actually.
Right. Yeah. Let's have a look. So do a full checkup and have a look at that area as well. How's life?
Good. Just.
Right, so till your head back, it's going to feel on your jaws and your neck, okay? Is that tender when I'm pressing there at all? Okay. Victoria, you can just get a battery for my loops. Right, and open as wide as you can, and close together. Open really, really wide, and close together.
There's always been a bit of a deviation there.
Yeah, kind of goes like right then left. So open really wide, So just checking these soft tissues. Okay, and curl your tongue up for me and into your right cheek and into your left cheek. And stick your tongue out for me there and back in again there. Okay, fine. That's all looking fine. So that's part of the cancer screening that we do for everybody. Are you working today?
No.
No. Okay, so open up really, really wide. Let's go through all your teeth, okay. So Victoria, we have upper right 8, 7, 6 as a crown, 5, 4, 3, 2, 1. Upper left 1, 2, 3, 4, 5, 6 has an occlusal composite, 7, and 8 just put a watch on the occlusal. Lower left 8, 7, 6, 5, 4 missing, space closed. 3, 2, 1. Lower right 1, 2, 3. 4 missing, space closed. 5, 6, 7, 8. Cool.
So I just remembered, I'm pretty sure one of the teeth recently back here has a little chip on it.
Yeah, on that top left.
Is that one of these? Yeah.
Yeah. Open really wide. There. You've got like a little wear facet on that second molar. You got an old filling on that first molar. Where do you feel the chip exactly?
I mean, on my tongue.
Yeah.
Yeah.
On that section.
On the inside.
Open up wide. Yeah, that's like your old. That's the tooth with that filling there.
Oh.
So you're feeling like a little rough edge.
It's not bothering me, I just noticed
Yeah.
it coffee right there. I was like, oh.
Cool. Right, I'm just gonna check your gums now. Okay. Okay, Victoria, upper right, BP's a 2. Upper central's a 2. And upper left is a 2. Lower left's 2. Lower central's 2. And lower right's 2. Okay. Just gently close together for me, halfway. Yeah, perfect. Just put a watch on the buckle of the upper left 8. Okay. Right, so it's open really wide. Any tenderness when I'm pressing along there at all?
Not really.
No. And that's all fine as well.
It's not sore, but maybe just some muscle there.
Yeah. Okay, right. So what I'm going to do is take some x-rays, okay? On the surface of it, it doesn't look like it's a dental thing. No, like, decays, cavities, cracks, no looseness, there's no pus pocketing around your teeth or anything. Your gums look fine. But we'll take some x-rays and we'll have a look. Right, so open up really wide. Cool. And just close together for me. Just bite down all the way on that. Perfect. And open wide. We're going to take a molar PA as well, Victoria. Open really wide. Cool. And close together. Bite down all the way. Cool. Open really wide. Just open up again. And bite down together for me. And open up really wide. Yeah, that tooth there. You've had your first premolars removed for the braces, I'm guessing. Your second premolars are like tilted. Okay. There's a chance that they probably have moved, and when you put the retainer in, it just puts like a little bit of pressure on that tooth, and that's why it causes it to be sensitive. Yeah. But there's no like recession or anything wrong with it. Because even if it's tooth, it might not have moved in a way that you've noticed it, but it could just move in the way that it's tilted. Yeah. Okay. Yeah. Right, this might be a bit uncomfortable. I'm going to try and get right to the back. So open up really, really wide. Okay, just gently close together for me on that. Cool, yeah, you can take it out. Yeah. Cool. Going to take a digital scan of your teeth. Then Victoria's going to take you through and do a full OPG to have a look at your jaw joints and stuff as well. So open as wide as you can. Cool. All right, and bite down together for me. Cool. And open wide. And bite down together for me again there. All right, cool.
You can take the glasses now. Come here. Stand close to here at your full height. Okay. So what you have to do to put your chin down here and gently with the front teeth bite the tip. And I'll ask you to curl your tongue up the roof of your mouth. It's up. Tongue is up, right? Okay, now the machine will be moving around you, making big noise. Please do not move until I come back. Ready? All done. You can let it go. Perfect. And you can return to the room now.
Thanks.
Thank you.
I was like, cool, brilliant.
Cool.
I think a lot of people are like, because they haven't, a lot of people can have like, obviously anxiety about the dentist, but it's not just about pain, it's about
Just experience.
the experience in general. So I think a lot of people find it useful to just see what actually
See what's
happens
gonna
and
happen
stuff.
during that
Yeah,
appointment.
what the conversation's
Just prepare
like.
yourself.
Yeah, what the room's like and all that kind of stuff. All right, cool. So go through X-rays first. So we'll do like sort of normal sort of checkup X-rays first. So your back teeth on the right hand side, we're looking for decay in between your teeth, any like signs of like bone loss, gum disease and stuff. That's the tooth that's had the root canal filling, and it's got a crown on top of it, and it all looks well sealed, no issues or anything. Yep, teeth on the left hand side, same, all looking completely fine. An old filling on this molar tooth, which I'll show you on the scan, it's like that's where you can feel the chip. Clinically, it's okay. We can change it if it bothers you, but otherwise we can watch it and keep an eye on it as well. I took a closer picture of this wisdom tooth because I thought there's a chance that there's like an infection coming from here,
Which one?
the top left,
Yeah.
because it's at the very back. You got a lot of calculus building up around. I think you
Struggle
might
to
be,
clean it.
yeah,
I do. I sometimes
Yeah.
get it, but I struggle to clean it.
yeah.
I'm pretty sure food always gets trapped right
Yeah,
there. There's a
exactly.
bit of space. And it's annoying.
It's even hard for me to scan. That's why I was taking a good look at it. I was like, maybe there's a big cavity there or something, but again, it's not. So no signs of infection or
What's
anything.
this? Just gum.
Yeah, that's just your jawbone. Yeah. Then the OPG, which shows obviously the whole jaw. So you see your sinuses, your jaw joints, your condyles, top teeth, bottom teeth. That's your root canal. Looks well filled right to the ends of the teeth. There's the wisdom tooth. That's like a bit of an angle. Looking for any signs of abscesses or
There's
issues
no
with the
dark space
roots.
in here or anything, is it?
Nope, nothing.
That's good.
Everything looks completely fine. And this isn't going to show like parotid gland or anything. So
Okay.
I reckon that cyst is probably a salivary gland cyst, either a parotid cyst or something else. But dental wise, everything's looking
That's
completely
good.
fine.
That's what I
Yeah.
wanted. Because if it's an abscess, I'll
Yeah.
have to. Yeah, be a pain in the arse.
The only like, there's like a little AI software. It scans the X-ray and like tells me things that often are wrong, but it does say like confidence score
22.
So, but it's like recognize the root canal, the filling, and then sometimes it recognizes decay quite well, but a lot of times you just gotta ignore it as well. Yeah, this area was showing up as a possible infection, but that's your sinus floor, and that's just
Above
darkening
the-
from the sinus
here.
on the top left, yeah. But that's looking completely, yeah. I'd say dentally, unless there's something brewing that's not evident, then I can't really see anything. So,
No, that's good.
yeah, and even when I was like feeling with my finger around your jaws to see if there's any abscesses or anything, it's all feeling completely fine. So, can look at the scan as well. So, top teeth. That's the tooth which you struggle to clean. It's hard for me to get a scan
Yeah,
there.
you can't get back to it.
But there's like calculus and stuff building up around there. See the hygienist
No.
to get that all cleaned up and stuff. And if it's persistently annoying you, we can take that wisdom tooth out. If it doesn't bother you, then
It's not annoying me that
Yeah.
much. It's just I have to get a toothpick every
Yeah.
time I eat. I'm not going to get a tooth removed because I prefer to
yeah.
remove toothpick.
Well, to be honest, I'm getting Alice to take my wisdom teeth out. They're fine, but it just really annoys me, the constant food trapping and
Yeah.
like I'm like I think I'm getting like bad breath from it and stuff. So I'm like, look, just get rid of him. But again, we can just keep an eye on it. Just keep going for checkups, and if any of this starts turning into like decay or something, then we'll get rid of it straight away, rather than waiting for like a big cavity form,
Yeah.
which makes the extraction a lot harder as well. So that's the tooth on the other side, the crown. Again, looking good. This is the tooth where you feel the chip. So that's just a bit of staining, a bit of early decay that's not deep enough for us to need to do a filling. You've had this tooth since you were 6, so there's a chance that a little bit of decay started and then you got better with like oral hygiene and it stopped. That's the old filling. It's just chipped from here.
Yeah.
Again, just keep it clean
sure
and
it
it
is
should be
it.
fine, yeah.
Sure. I think we're
Lovely.
Lovely.
And then bottom teeth again. So there's this is the one where you get a bit of sensitivity from.
Yeah.
So you see how it's kind of, it's the best kind of angle.
It's coming in.
Yeah. So there's
I
a
can see
chance that space probably might have been closed and it's just like opening
Right.
up a little bit. So when you put the retainer on, it puts pressure on it, which then irritates the gums and then causes sensitivity. So definitely I would say get a retainer made, because if you look at your bottom teeth, I don't know what they're like before.
Well, annoyingly, it started. I got a retainer made. So my ones are getting holes in,
Yeah.
and I swear it was after I got the new retainer made that it started hurting.
Mm-hmm.
And I spent like £500 on them, and I was a bit like, it's a bit annoying. It was like a few
Yeah.
months after that I noticed them getting sensitive, and I dealt with it for a while, and then I just stopped using them.
Fine. Was that when when you went for your root canal and stuff? Was it then or?
No, that was in it's maybe a year or two ago. It was really. I got my root canal. Actually.
Okay.
Yeah.
Fine.
So I don't know. It's just a bit annoying getting one done for like £500, and then it was like half a year later.
Yeah,
I was
getting
like,
another one.
This
Yeah.
is sore.
Was it just what kind of retainer was it?
Was it Invisalign?
Like a sort of clear aligner?
Yeah, just
like
from
a
that time.
plastic one. Yeah.
Yeah. But the only way to help that was get another one.
Mm. Yeah. We can't like adjust it or anything. So.
Is there any benefit in getting? I don't really not like want it, but in getting actual Invisalign to try to straighten these up. Is there any need in that? The problem is, would that affect my bite?
If we did it, we'd factor in your bite.
So, yeah.
Yeah. There's no need.
Like, I mean, this shape doesn't bother me.
Yeah. No need. Teeth, when they're crowded, they're harder to clean, but yours are so minimally crowded that you'll still be able to floss and stuff around them. If there's a space, you can get food trapping, so ideally you want to close them. But again, if you're keeping them clean and it's not an issue, then it's fine. It'll become a totally like up to you kind of like decision. It'll become like
If in like 10 years' time it's annoying me,
yeah.
what would it be? Would it be pull this one laterally so there's space for it in here?
Yeah.
Yeah. Okay.
Basically, bring those canines out, make space, and rotate those. What I would suggest is definitely get a retainer made. Because what you don't want to do is, this is like really minimal, to wait 10 years until they're actually crowded, and then you're in like a much longer like aligner plan. Like if they get worse and worse, they tilt more and more, then what would be like a 6 weeks of aligners to straighten them?
What would happen if I start using my retainer again? and I just
Your old one.
yeah, and I just persevered.
See how it feels.
Would
Ideally,
do you think it would adapt to it after like a few months?
it should do as long as it's not moved too much. Because what you don't want
It's
to do.
still fit.
Yeah. Maybe when I'm around one day, try them in and let me have a look.
Okay.
Or if you're going to book the hygienist here, bring them with you.
Okay.
And then try them in. Because basically, if teeth move slightly, we can use the retainer to kind of push it back.
Yeah.
If they've moved significantly, then it's just a complete wrong.
They just
The force and the pressure is like completely wrong, and you either cause damage or it's not going to move the wrong way, or the retainer will just break, kind of thing. So,
Okay.
yeah,
Fine, I'll think about that.
cool. And then
Good, but nothing's wrong.
yeah, all looking good. Bit of recession up here.
I've had that for a while.
Yeah,
A hygienist noticed that a few years ago.
yeah. We'll just keep an eye on it. What kind of toothbrush do you use?
Probably. Like an old
Fine.
allergic
Okay.
one.
But yeah, we'll take these scans like every year, and we can see how things are changing.
Okay, grand. What causes this? I got explained before, but I can't remember.
It's hard to know exactly. There's a few different things. Either brushing too hard, and loads of people with the manual toothbrush will just scrub really hard and they'll irritate the gum, and the gum drops back. Braces. So when you had braces, if you've moved the canine out and the gum's gotten really thin,
Oh, I did have
cause
that. I had
yeah.
them. I used to have an underbite.
yeah.
So my top teeth got pushed out.
So if you imagine, to be fair, for your
That's why
case, it's probably
kind
is.
of tilted forward. I think.
Yeah. If you look, that's the kind of natural arch of your maxilla. If those canines are sitting at the very edge of the bone, then the gum's can be really thin. And then it becomes a combination of like thin gum, brushing, they're more likely to recede. Or if you're grinding and clenching and you're putting pressure on that canine, the gum can
I
recede
used
as
to do
well.
I think a clench, grind.
So there can be loads of different reasons. It's hard to tell exactly what. For you, I think it's probably a post-braces recession.
Okay,
Cool.
cool.
Any other questions?
No.
No? Keep me updated on how this swelling is and...
Yeah, I'm
Yeah.
hoping it just slowly goes down.
Yeah.
But now it's because the sack's been cut. And it squeezed it out. So
Yeah.
maybe now it just naturally starts to drain.
Because I even checked your parotid gland and it's like there's no like definitive like swelling in your parotid gland, but obviously I can't feel it all, and that's not what I do regularly. So if it doesn't go away, it'll be a case of sending you to like oral medicine,
What's that?
like an oral medicine department. They deal with all like the soft tissues. They could do like a further screening to see if it is like a gland issue. Because if you've got like a blocked gland and that's causing the swelling, then they can sort of clear it. But yeah.
So hopefully this goes.
Yeah, hopefully it goes. Hopefully it is
Not
just like
painful anymore.
Yeah.
Yeah. Okay, Gran.
Cool.
The only thing I was going to go to the third space in Canary Wharf.
Yeah.
But literally as I was doing the consent form, I realised I didn't take my antibiotic this morning.
Oh, really?
So now I'm going to go home
Go
and take
home.
it. Yeah.
If you want to go back, I'll be going there at 3 o'clock, as long as no one books in.
Hey, you come back here for the trip? No, I'll probably go to Clapham.
I thought so.
Just a quick, like, 50-minute commute again. Drop this back.
Oh, yeah.
I might get some food though. What do you recommend around here?
There's a pretty decent lunch place. Will they be selling lunch? If you go down that road there, there's a place on called Fika Exchange.
Okay, down where the sign is.
Yeah,
down there.
yeah,
Barrier.
yeah.
Okay, cool.
Through that building, past that building, they do quite good lunches if they're on now. Otherwise, there used to be a good biryani place, but that's closed. There's a really cool Korean chicken rice place. Yeah, go to Fika. It's a good option.
Right,
Yeah.
thank you.
Are you going to book hygienist here, or are you going to do that near yours?
I don't know.
Okay.
Maybe here.
Yeah.
But I may, I don't know. If it's on Wednesday, I could come here and actually go to the gym. But if not.
Do that on a Wednesday towards the end of the... No, Gita's not in on Wednesday, is she?
No.
Thursdays. Oh, yeah.
You can. What about Saturday? Saturday?
I'd rather Wednesday.
No, our hygienist isn't here Wednesday.
So we don't have
Yeah,
it.
we don't know when here.
When's available?
Monday, Tuesday, Thursday, Saturday.
Monday, Tuesday, Thursday. All day?
Uh,
Yeah.
Okay. I don't know yet.
do you,
Fine.
Yeah.
Yeah, I think if you want to go close to yours, then it's fine.